And also a reminder to please remain on mute during the presentation. Dr. Nicole still received her MD and fellowships at Mount Sinai School of Medicine. She also did her internship and residency with Mount Sinai School of Medicine. She is certified through the American Board of excuse me, obstetrics and or gynecology, and she treats a wide range of conditions along with provides routine office wellness visits. Thank you, doctor, for being here today. I will now pass it on to you.
Okay, thank you for having me, Isabel. And for everybody who's tuned in, it's a little unusual to do a presentation and not be able to see anybody, so I'll try my best. But these are the times we're still living in, 2 years since COVID started. As Isabel said, my name is Nicole Astle. I'm a gynecologist with a subspecialty in minimally invasive gynecologic surgery. But I also do some regular routine office gynecology. I do not do any practice of obstetrics anymore or delivering babies because of my focus in gynecological surgery, which means really doing a lot of hysterectomies, ovarian cystectomies, endometriosis. So I'm really a specialist in those things, but I also provide routine well woman care for patients who need a gynecologist. And most women keep going to their gynecologist regularly for their pap smears and also for their birth control. So we're going to talk about birth control today and go through some of, well, really all of the options. And at the end, you'll have a chance to ask any questions about anything that you want to hear more about. So one of the things that I think gynecologists are sort of constantly trying to impress upon our patients is how common unintended pregnancies are. Really, really, really common. People think it's not going to happen to me, but it happens. Nearly half of US pregnancies were unintended in data from 2011. And so on this graph, you can see 55% were planned intended pregnancies, 27% were mistimed pregnancies. So, women who are kind of open to conceiving and, not against it to the point where they would consider an abortion or anything like that, but they weren't, planning to get pregnant at that time. And then 18% were fully undesired pregnancies or unwanted. And, for a woman to be in that position is really, really, really difficult. And birth control is all about helping women avoid being in that position. And you can see unintended pregnancy rates in the U.S. by states. New York, New Jersey over here, we fall into a high rate of unplanned pregnancies. Not quite as high as the Deep South, okay, but we're high, okay. So this chart has kind of, an overview of all the different forms. And you've probably seen something like this in your lifetime, whether this one's from the CDC, maybe it was at the doctor's office on the back of the door as a poster or in a magazine. But it's a pretty common representation of the main types of birth control. Okay. And so they go here from least effective at the bottom to most effective at the top. Okay, so the least effective methods are using things like just spermicide alone or fertility awareness-based methods, or people call that the rhythm method or natural family planning. It goes by many different names, but that's really just means avoiding having intercourse when you are during the fertile time of your cycle. So it's tracking your cycle on a calendar, and now there's lots of apps that help you do that. But that method really only works well if you have very regular periods and if you're very consistent about tracking it, and you also are good about avoiding sex or using condoms or some other form of birth control during the time that you are in your fertile window. So with that, there you can see how there's lots of room for error because a lot of those things have to line up to be using it well and for it to work well for you. Male condoms are here. The great things about condoms in terms of their use is their prevention of sexually transmitted infections. They are not that reliable, however, for preventing pregnancy in terms of what we talk about average use as opposed to perfect use. People who are sort of say they're using condoms as their method of birth control, they may not be using it every time, or the condom may break or rip or slip or have a hole or something happens. So even somebody who's kind of using condoms as their main method may not use it perfectly every time. And that's where the failure rate really comes in. Female condoms are a less popular choice. They're really pretty cumbersome to use, but at least it's something that puts the control of using the condom in the woman's hands instead of the male partner's hands. So that is one of the advantages, is that you can have a little bit more control over the situation. Withdrawal, also known as pulling out, is another fairly common method that people use for their birth control. But also, much like condoms, its typical use is not that effective, because if the male doesn't pull out in time, then you can have ejaculation of semen into the woman's vagina and you're at risk for pregnancy. So not very reliable. The sponge or different, also not as reliable. It may be blocking some, but not all of the sperm. Okay. Then we kind of go up. So I would say most gynecologists, oh, the lights in my office are on a timer. They go off all the time. Most of these methods really aren't, recommended by gynecologists. We really prefer for patients and recommend for patients to stick with something that's more reliable. Now, that's not to say that somebody can't use one of these methods really, really well. And I certainly have many patients who use one of these methods and they don't have unplanned pregnancies because they are really consistent in their use. And if you're very consistent in using it, they can be effective, but where the main drawbacks happen is how people typically use these methods. So if we go up to the sort of the next line up here, these are more effective. So these are getting into your prescribed medications for birth control. All of these forms in this line have hormones in them, except for the diaphragm, okay? But where we have the injectable here, okay, that's known as the shot or the Depo Shot. The pill or birth control pill, that's one of the most commonly used methods. Also the patch, which is a sticker you put on your skin, and the ring, which is actually a ring that you put inside the vagina. And there's a couple different options for that too. So we'll go into more details about these later. Okay. And then across the top, these are the most effective methods of birth control. They have the lowest failure rate because, well, so on the left side here, we have the implants and the IUDs. So these are plastic devices that a doctor needs to place in your body. The implant goes in your arm and the IUD goes inside your uterus. It's placed, by a office procedure with a vaginal exam. And there's really no way for you to mess it up. It is in there working until you purposefully go to the doctor to have it removed and taken out. And that's really why they're so effective, because there is nothing that you need to do to make it work for you besides get it placed. And they have ways to check them, but they are highly, highly, highly effective. Most gynecologists I know use some form of an implant of their birth control because we know how well they work and we believe in them. And then the last category over here is what we call sterilization as a medical term, but most people know it as getting their tubes tied when you're talking about the woman getting it done. We'll talk about that a little bit more later, or a vasectomy when the male partner has surgery. Both of these are surgeries to permanently not be able to have children again. So really, these are typically done in long-term relationships or married couples. But I would say not exclusively. I've certainly have patients who've said, I never want to have children and I would like you to do surgery for me, even if they're not married, but they know they never want to have children. Just want to make sure it's the right side. So, I talked a little bit about efficacy on the last slide. Okay. But here you can see where I was talking about perfect use versus typical use. Okay. So something like no method, well, you're not using anything. You have a really high risk of getting pregnant. Okay. These are the risks. The percentages here are women who have an unplanned pregnancy within the first year of using this method. Withdrawal or pulling out. So perfect use has only a 4% rate of getting pregnant. So that's a 96% effective rate. That's really pretty decent. But typical use has a 28% chance of getting pregnant. And so that's really where the problem is with this method, along with periodic abstinence, which is that natural family planning or the rhythm method, and condoms. They all have this sort of much higher typical use failure rate. So that's why they're typically not recommended by gynecologists. And then as we get down into our prescribed forms of birth control, the pill, the patch or ring, DMPA, that's the Depo Shot. Okay, the typical use still has a higher failure rate than the perfect use. Okay, because the pill is easy to forget. A lot of patients, myself included, when I was on the pill, certainly, can forget to take your pill. You're supposed to take it at the same time every day and not miss a pill. So if you do that perfectly, and lots of patients do, especially now with technology, they set a foam alarm and they're really in the routine and they do it, that has a really low failure rate, less than 1% chance of getting pregnant. But the average or typical use can be as high as a 9% failure rate. Okay. And similar for the patches and the rings and the Depo Shot. Okay, what down here when we get into the implants, so the Nexplanon is the arm implant, the copper T IUD is one type of IUD, and the LNG IUS is just a different type of IUD. Okay, so when we look at these, the typical use is almost identical to the perfect use because it's out of the hands of the user or the patient to do anything. And that's why they're so highly effective. And then most effective down at the bottom, well, not necessarily, pretty similar with the IUDs, are having female or male sterilization, having surgery for no more children. This is just a little chart showing what are popular uses of birth control in the US. Contraception is kind of our fancy medical term for birth control. So I think a lot of times what I see what happens with patients when I ask them, what are you using for birth control or contraception? They tell me nothing because they think of it as just being on the pill or on some kind of medicine. But especially, when doctors use that term, we mean anything that you're doing to not get pregnant. So we include the pulling out or the condoms as a form of birth control. When we say it, we're not really just talking about the pill. And so here you can see lots and lots of women are currently not using any form of birth control. So 35% of women, maybe because they're not having any sex, maybe because they're pregnant or postpartum and not having intercourse. But obviously, if they're already pregnant, they can still be having sex, but they just can't get pregnant again. That's a one-time deal. Okay. But down at the bottom, of the 65% of women who are using birth control, the most common method is having female sterilization, which is having your tubes tied. And that's because it's the most popular method of birth control among married couples. Okay, so I haven't had a chance to see who's in the audience and if this is mostly a married couples kind of audience or if there are some younger women included in the group. Male sterilization or a husband getting or male partner getting a vasectomy is significantly lower. And then of the kind of other choices, the birth control pill is really a classic. It's 14%. It's really pretty high. But the 10% down here using the long-acting reversible contraceptives, those are what are another term that we use for the implant. So using an IUD or an arm implant, they've really gained popularity. I think some patients are a little reluctant to use them, but they've been around for a long time now, and more women are realizing how easy it is, especially for busy women. It's there's no maintenance there, and they really work pretty well. It's just a simple office procedure to have it placed. We can skip this one. Okay, so I'm going to go into a little bit more detail about the different methods that we talked about. So natural family planning, also known as the rhythm method. Okay, this is really timing your cycle and avoiding when you are fertile during the month. So here, menses is our fancy word for your period. Okay, so this is looking across a month. So at the beginning of your cycle, okay, the beginning of your cycle is when you're having your period. For us, we don't talk about that as the end of your cycle. That is the beginning of your cycle. So day one of your cycle is the first day of your period. Okay. After that is something called the follicular phase, which is when the follicle, which is the little cyst that grows an egg in your ovary, starts growing the egg and growing and growing and getting ready to release the egg. Okay. And then after the egg, when the egg is released, that's ovulation right here. So your risk of pregnancy is highest right at ovulation, but also before ovulation, it's really going up. It goes down quickly after ovulation. And that's because the best way to get pregnant is for you to have sex right when the egg is coming out, or for you to actually have had sex right before, a day before or 2 days before, because the sperm can survive inside the woman's body for up to 3 days. So if you have sex the day before you ovulate and your egg comes out, that's really great because the sperm are still alive, they're still there, and the egg basically comes out of the ovary and just lands into the sperm ready to fertilize it. If you're trying to get pregnant. If you're not trying to get pregnant, this is not the good time. Okay. And so there's a pretty big window here. Okay. It can really be 5 days, sometimes 7 days. Okay. And so that means a long time each month that you need to be avoiding intercourse and to be sure that you're in that window. Okay. After you ovulate, there's only a little bit of fertility after that. It goes down pretty quickly. And then you're just at the end of your cycle until your period comes. Different ways to kind of keep track of that is using a calendar, cycle beads. You can also look for signs of ovulation. And these things are helpful to know about because you might be trying to avoid pregnancy at one point in your life, and you might be trying to aim for pregnancy at another point in your life. So having a good understanding of how this method works and being educated about it is just useful for you to know about your body. The cervical mucus method is a way that you know if your cervical mucus is thin or slippery or stretchy. That's a very, very good sign of ovulation because that mucus thins out. Normally it's a little bit more thick and like a plug, and you don't see it or notice it. Okay, it's acting as a plug to help protect your uterus from having infection. But when it's time for you to get pregnant, that plug thins out to let the sperm in through the cervix. Okay. And most women, you can either actually stick your fingers inside and reach for your cervix and kind of see what the mucus feels like and stretch it out. Another way that people can tell is even just when they're going to the bathroom, they just notice when they wipe after peeing that there's just like a slickness there, or in their underwear, there's just a clear, slippery, doesn't have any odor, but just a slick wetness there. And that's the cervical mucus change. And if it's happening the same time in your cycle, which right in between your two periods, that's a really reliable sign of ovulation and a time to avoid having sex if you don't want to get pregnant. Barrier methods are a name for anything that is a barrier. Okay, so that's condoms, male and female, and diaphragms. Okay, what's really good about these, and especially can't stress this enough for patients, for women who are not in a long-term monogamous relationship, is that these are the only things that can protect you from pregnancy and protect you against sexually transmitted infections. So we prefer that women not rely on them for birth control alone because they're not as effective for that. But we always recommend that women who are not in a long-term monogamous relationship to use a barrier method like a condom in addition to an effective birth control method. Okay, to use something in addition to that for the birth control. Breastfeeding, I know this talk was advertised for after baby and beyond, okay? And breastfeeding is an effective form of birth control, but I think often, I feel I'm often dispelling the myths, not to the way that a lot of women think. And I cannot tell you how many times I have seen patients who were pregnant with a 6-month-old at home because they thought they couldn't get pregnant because they were breastfeeding, and they're crying. They're crying in my office because that's the last thing most women want when you're still adjusting to having a 6-month-old is gearing up for another pregnancy. Those are not fun surprises. And the way that breastfeeding works as a birth control is that the hormones from your brain that tell the breast tissue to produce milk also suppress your ovulation. But you have to be breastfeeding exclusively and on demand. So if you're doing any kind of formula supplementation, it's not going to work. If you're sort of skipping breastfeeding or pumping through the night, it's not going to work. And it only works for the first, if you're less than 6 months postpartum and you're not getting your period. The trick about this method is you don't really know when it's ending because your first egg comes out before you get your first period. So, if you're not getting your period, you think, oh, I'm good, I'm good, I'm good. But I've definitely had patients who don't know they're pregnant until they're 4 or 5 months pregnant because they never got that first period. Their body released the first egg, that got pregnant on that first shot, and their period never came. So all this time, they're thinking, oh, I'm just breastfeeding. And that's why I haven't gotten my period until they really get pretty far along and notice some other changes. And it's really that they've gotten pregnant. And that's the reason why they're not getting their period for the last 4 months. So combined hormonal methods that's a term that doctors use to talk about a hormonal method that has the 2 different hormones in it that we use for most birth controls. So that's an estrogen and a progesterone. So that's why it's called combined, because it has 2 different hormones in it. And those are your pills, your patches, and your ring. Super common prescribed birth control that women use. I think you're probably all, mostly familiar with the pill. It's been around for so long, and it's one of the most common types of birth control that women use. You take a pill every day at the same time and not get pregnant. The patch is designed to be a little bit easier to use. It's a similar formulation of hormones, but it's delivered through your skin. It's not a pill that you take. So it's a patch or a sticker that you put on your skin, and you only have to change that once a week. So that's a little bit less maintenance than taking a pill every day. Then there's the ring, which here we have monthly use for this, but there's a newer ring on the market that you can actually use for a whole year. And so they're flexible silicone rings that you yourself insert into the vagina. You don't need to go to the doctor for them to put it in. So this is for women who are obviously comfortable with their bodies and feel comfortable placing it and removing it. And they are less frequent than daily or weekly. You're extending out to monthly use. So that's a little bit easier for patients to keep up with, for women to keep up with. And these are moderately effective. Again, we talked about the typical use. Your pill, you forget to take it a couple of days in a row, it's not working for you. Or if you can't get to the pharmacy on time to get your refill and you don't start it on time, it may not work for you that month. I know a lot of my patients really ask for having a 3-month supply at a time. I'm always happy to give that because it is so much easier, but it's really up to whether your insurance company pays for it or not. So progestin-only pills are a special type of pill. They're not combined. They don't have the estrogen and the progesterone. So they have progesterone only in it. Progestin is just like a shorthand term for progesterone that we use. And so these pills are even less reliable than regular birth control pill because you need backup birth control if you're more than 3 hours late taking the pill. So that's not a big window. With a combined birth control pill, it's still pretty effective, even if you miss a whole day. But this, if you miss more than 3 hours, you're not taking it at your 9 a.m. or whenever you set to take it, it really does have a much higher failure rate. But these pills are important because they're really ideal in women who are breastfeeding or women who can't take estrogen. And there's a lot of women who fall into a category where they can't take an estrogen containing hormone birth control because of medical problems. So women who have high blood pressure, who have had a blood clot in their legs before, women who have had a stroke, women who are over 35 and are smoking, women who are younger but are very heavy smokers should use estrogen-containing birth control with caution. And then in younger women, one of the most common things, so, a lot of those things sound like something that affect older women, and typically they do. In terms of affecting younger women, migraines that have an aura, which is a sensation that you're going to get a migraine before it happens, not the nausea that comes with it or that the lights bother you, but whether something else like seeing floating spots or having changes in your vision. Sometimes people can have a smell every time they notice this smell and they know, oh, okay, I smelled that burnt rubber smell. That means my migraine's coming. So if you have migraines with an aura, it's not safe to take estrogen because it can increase your risk of having a stroke. So these progesterone only pills are important for women who cannot take estrogen. The Depo Shot is an injection that you get every 3 months. It is a progesterone only form of birth control. So it's another great option for women who can't take estrogen for some reason because it's not combined, it only has the progesterone. And so you get it every 3 months. And one of the benefits of the shot, besides the birth control, is that it can make your period lighter and irregular. Sometimes your period stops completely. I kind of always describe the Depo Shot as I feel like my patients have a love or hate relationship with it. You know, I have so many patients who love it. They've been on for years. They never want to go off their Depo. They're so happy on it. They don't really get their period. They don't get their cramps. And, you know, they don't have to avoid having sex when they have their period. They're so happy with it. Other patients, if they have some of the negative side effects of Depo, they're not as happy. So weight gain is one of the more common culprits for Depo, and of all of the birth control methods with hormones, I would say it does have the highest risk of weight gain. And so, you know, women who gain weight on it tend to not be very satisfied. Some women also don't get to a point where the bleeding really gets much better or it stops being irregular. They might have frequent light bleeding, sometimes every day for 6 weeks, becomes 12 weeks, becomes 3 months, like needing a panty liner every day. Most of the time, that kind of bleeding will get better. But for women who it doesn't, that they're not satisfied with that option. The implant, okay, there's a picture here. It's a small plastic rod, okay, that has hormones in it, but just progesterone hormones. So again, this is safe for women who cannot have estrogen for some reason. The brand name of the one that we have now, currently FDA approved, is Nexplanon. There's some older versions out there. Implanon was sort of an old version, but Nexplanon is the current version that you can get. And it's approved by the FDA for up to 3 years, but it's effective for even up to 5 years. So they might change the labeling soon. Some patients are okay with leaving it longer. And if they're okay with that, I agree too. The risk of pregnancy is low, but it's definitely good for 3 years. The implant, it has some unpredictable side effects, I would say, is one of the downsides of it. The upside, it is a highly, highly, highly effective method of birth control. Like I've said before, you know, because you have to go to your doctor's office and put it in as an office procedure, it goes underneath the skin in the arm, in that area in the picture. You can't take it out by yourself. You can't mess it up by yourself. It's there working until you decide, okay, I don't want it anymore. I want it taken out. But as long as you have it in, it's going to be highly effective for preventing pregnancy. 20% of women have amenorrhea, which is our fancy term for not getting your period at all. 40% have infrequent periods. So they might have one, you know, like a light 3-day period every 2 to 3 months. And so these are great side effects for women who would prefer to not deal with their period. A lot of my patients are, you know, worried that that's not safe, or that's not healthy, or that's not normal to not get your period every month. But the way that these birth control methods work with the hormones is that it's not that it's preventing your period from coming out. It's that it's telling your body to not make the blood every month. And so instead of building up a lining and building up blood in the uterus every month for it to come out, it just doesn't do that. It's actually cleaner inside the uterus than if you're getting your period every month, because it's just the hormones are telling the lining to stay very thin and not to build up blood. So these are also great options for women who just have problems with heavy or painful periods, because if we can get your period to go away completely, 20% of women, they don't get their period at all. Well, fantastic. Now you have great birth control, and we've solved the problem of having heavy or painful periods. As a gynecologic surgeon, I use a lot of these methods a lot because a lot of patients are seeing me for fibroids or heavy bleeding or some other gynecologic condition. And I really like using the Depo Shot or the implant or the IUDs to help with that. So we'll talk a little bit about the IUDs. So these have been around for a long time. They're kind of like one of the original birth control methods. If you place something into the uterus, a baby cannot grow easily there. And so there's just like a picture showing of different styles and types from different times in history and different countries around the world. The ring ones, the full circles, those are popular, or were popular in China once upon a time. I've actually taken out one of these from a patient from Africa who had an IUD had to come out. It was this sort of squiggle shape. Okay. But here in the US, we have only T-shaped IUDs. Okay. And there's basically two different types that we have. We have the copper IUDs, and we have the hormone IUDs. So here, the hormone-free one, the only one that doesn't have hormones is the copper. Okay, and the hormonal ones, we have a few different types by name: Mirena, Kylena, Skyla, Leleta. This slide shows it a little bit better. Okay, so all of the hormone IUDs, these are really just different brands with slight differences of how long you can use it for, what the dose of the hormone is, slight differences in the size of the IUD, but they all have the same hormone, levonorgestrel, which is a type of progesterone. So they're all very similar, okay? And these are really, really effective. The copper IUD is sort of the original IUD that's been around for a really long time. It's made with copper wrapped around, it's still a plastic tee, but there's copper bands wrapped around it. And that can be used for up to 10 years. Okay. The big advantage of the Paragard is how long you can use it for, and the fact that it doesn't have hormones. Lots of women are really resistant to using hormones. But most of the non-hormonal methods are also not that effective. Things like natural family planning, or condoms, or a diaphragm, or a sponge, or spermicide, those have high failure rates. Most of the things that we talked about in the medium category have hormones in them. And so the copper IUD is really effective without having any hormones. The potential downside of the copper IUD is that a common side effect is to have heavier periods with more cramping. But for women who only have a period that lasts 3 or 4 days with mild or no cramps, no problem. You might go on to have a little bit of a heavier period. Instead of changing your pad twice a day, maybe you're changing it 3 times a day. Maybe it lasts now 5 or 6 days instead of 4 days. And maybe you have to take Motrin on one day of your period. But for a lot of women, even if they have that side effect, that's a pretty small trade-off for having really effective birth control that can last them for a whole decade. For women who already have problems with their period being too heavy and too painful, this really isn't a good option. And if they want to do an IUD, I really recommend that they do a hormone IUD. Sterilization is our, fancy word again. Oh, my lights. For having surgery to not get pregnant. So commonly we call it tying your tubes, okay, which is really a misnomer. There's been so many styles of the way that we do surgery for tying tubes. In fact, now we don't even tie them anymore. We don't even tie and cut and burn them. I have patients say to me all the time, what we really do now is the most common method, and I do a lot of these because I'm a surgical subspecialist, is we actually remove the tubes completely. And not just because the instruments that have become so sophisticated of what we can do with minimally invasive surgery. And we can do this with 3 little half a centimeter incisions, really, really cosmetic, and we remove the tubes fully. Another benefit of this method is it's extremely effective, but it also comes with a cancer risk reduction. So more and more we think that ovarian cancer isn't really coming from the ovaries, it's coming from the end of the fallopian tubes and landing on top of the ovaries and causing cancer. And so studies have shown that women who have actually had their tubes removed to no longer get pregnant also have a lower risk of developing ovarian cancer. Okay. The downside, of course, to having surgery, especially now where we remove the tubes fully, is you can't undo it. You can't untie it. You can't put the tubes back in. It's considered permanent. And so it does have a risk of regret. And then for men, the name for the procedure they have is a vasectomy. In my experience, plenty of men or women come in saying their husbands won't do it. They don't want to do it, as a woman, I feel that's just kind of unfair. It's one more burden that women have. It's not enough that we have to, be pregnant, deliver the baby, and be responsible for all of that in the family. I always say, tell your husband it's his turn to do something for your family planning, but that doesn't change that a lot of men are really reluctant. And then just to finish out kind of the last category of emergency contraception or emergency birth control, I think most women are really familiar with Plan B. It's now available over the counter. I find a lot of women don't realize that part about it, though. You no longer need a prescription for it. You can buy it over the counter, and it can work for up to 7 days after having unprotected sex, but it's more effective the sooner you take it after sex. And that's because it does not create an abortion. The way that it works is that it inhibits your body from releasing the egg or ovulating. Okay, so even if you were just about to be at the point where you were going to ovulate, if you take the medication, that dose of hormones will stop the ovulation. So it only works if you're about to ovulate or we're close to it. If you already ovulated, it's not going to work. It's, if you ovulated and the sperm got there and you got pregnant, this isn't going to do anything. It wouldn't harm the developing baby at all. It just wouldn't do anything. It only works if you catch it before ovulation. And so that's why it's more and more effective the closer you take it. If you wait up to 7 days, well, you might have ovulated on day 4 after you had unprotected sex. And if you take it on day 7, well, that's not going to work for you. But if you had unprotected sex and then 4 days later, you were going to ovulate, but you took Plan B on day 2 or day 3, that will stop that from happening and you will not get pregnant. Okay. Ella is just a different, it's not exactly the same hormone. It has a different way that it works, and you still do need a prescription for that, but it is something you take after. Oh, and I forgot to say, Plan B, that's the classic, the morning after pill. That's the other thing that people call it. What I find very, very few women know is that you can actually have an IUD placed as a form of emergency birth control. So the copper IUD is really the best one for that, and that works for up to 5 days after unprotected sex. And so that's a really great option if you were sort of thinking about getting an IUD, or maybe this is your first or second pregnancy scare and it kind of gets you going to commit to actually having a long-term birth control with it and say, oh, it's the first time I had a scare or the second time I had a scare, I'm going to get quickly into my doctor's office and get an IUD placed, so I don't have an accident with this unprotected sex. And then I'm also covered for the next 10 years until I decide to take it out. Okay, so thank you. That was those are my slides. I can go into any more detail. I think people might have some questions about side effects, because I didn't get into a lot of details about that. I know patients are always asking about that, but I just want to kind of give a brief overview and open the floor for any questions.
Thank you, doctor. That was extremely informative. We do have some questions coming in. I'll start with one. It says, what is the recovery time like for having fallopian tubes removed? Are you out of work for a few days, or are you able to get back to work right away?
So typically it's same day surgery. So you come in and go on the same day. The incisions are really very small, 5 millimeters. And it depends what you do for work. I usually recommend for people to take the next day off, for sure. Maybe a couple days, especially if your job will give it to you. For my patients who are having surgery, I encourage them to kind of take as much time as their job will give them, because, as working moms, like none of us get enough rest. So take the break if you can get it. But really, a couple of days is more than enough time. If you have a physical job with a lot of heavy lifting and strenuous activity, then you might need to be out for a week or 2 weeks if it's really heavy lifting. I have one patient who works for Amazon and she unloads the trucks into the warehouse. So somebody like her, needs like a, 2 or 4 weeks if you're really doing strenuous work all the time. But for your basic light activity job, 2 to 3 days, maybe a week is really, 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 really generous.
Thank you. And we have one more question. Can birth control pills affect a cyst, or make them grow, even though they've been removed? Specifically, dermatoid cysts.
Oh, so dermoid cysts, no. So dermoid cysts are their own sort of unique category of cysts where they can grow, teeth and hair and all this like unusual, that I think is cool stuff. Other people think is gross in these cysts. But there's nothing that can really suppress those from growing or make them grow. They're kind of independent of a hormonal response. Some functional cysts, as we call them, which are the cysts that come from ovulation, or the corpus luteum that forms after that, those can be suppressed by birth control potentially because you're suppressing the ovulation. So people tend to not get as many as those, but not with a great effect. So I would say, a person with a history of dermoid cysts can really use any of the options of birth control that we talked about, and using something like a birth control pill would not at all increase the risk of having another cyst.
Alrighty, thank you. And there's one more last final question. Is it safe and normal to be on birth control that completely stops your period?
Yes. So I always tell my patients, it's not okay to not get your period by yourself naturally, because if you're not on a birth control that's making that happen, then something's wrong with your body's own hormones. They're not cycling in the right way. So that's not normal. For women who aren't getting a period by themselves, we actually need to give them medication to bring their period. But for women who are on a kind of birth control that's stopping their period, that's very normal. And we use that all the time as a desired side effects for women who have problems with periods being too heavy or too painful. And the way that those hormones work is they suppress the body from making the lining and making the blood to build up every month. It's not stopping it from getting out, it's just keeping it thin. And so it is healthy for you. And a lot of those methods also have a decreased risk of endometrial cancer in the future because it's suppressing that endometrial lining from growing. And so with that suppression, it's not growing a lot. Cancers happen when it's growing and growing and growing and growing and growing too much. So most of those hormonal birth control methods, because they're suppressing that lining from growing, they actually do have a cancer risk reduction.